Well, talking your health again today, and both men and women undergo dynamic change as they age, and the concept of male menopause is gaining ground in the health world, with testosterone replacement becoming a very popular question for middle-aged men when they go to the doctor's office. Joining us to discuss this is Dr. Ben Baechler from the U of M. Thanks as always for being here.
Pleasure.
So this is called andropause. What kind of symptoms should one look out for, and are we talking about when it comes to this?
You bet. Well, both men and women have a rapid period of change in their bodies as we age. In women, very defined menopause set of symptoms. In men, in more general and gradual. But specifically, we think about decreased energy, decreased mood, decreased performance and libido, decreased muscle mass, and increased central obesity. Those can be some of the symptoms, or concerns, I should say.
And we hear low testosterone, or low T. It seems you can't watch a sporting event these days without seeing a commercial about it. Define a normal range, I guess, of testosterone for men. What should they be looking at?
You bet. Well, first and foremost, the definition of andropause is tied a lot to the main hormone for men, that being testosterone. So that's the main hormone we are talking about. And there are set ranges based on age of testosterone. Unfortunately, for men, testosterone production usually peaks in the 20s, and then there's a decrease. So it's really an age-adjusted level. And there's both total testosterone levels and free levels that we measure in the serum.
And testosterone replacement therapies are out there. That's what a lot of these advertisements are about. Is it a good idea?
We need to be very, very cautious. Of course, the right medication and the right patient at the right time, it can provide wonderful results, but it should not be the first thing that we jump to. Testosterone replacement can be associated with increased risk for stroke, cardiovascular disease, or heart attack, potentially increased risk in certain types of cancers, acne, sleep apnea, as well as even gynecomastia, breast development in men. So it's not, it needs to be taken very seriously and shouldn't be the first thing we jump to. Fortunately, there's a safe and logical approach that we can take to evaluating men who have symptoms of concern.
Yeah, you talk about those risks, because another commercial I seem to see a lot are these legal firms that are talking about men who have taken testosterone replacement therapy, and have you had cancer, and have you developed heart problems, or all of that. So it can be risky.
Absolutely. It shouldn't be the first thing that we jump to as health practitioners or as a patient. So we need to evaluate other potential causes, medical evaluation. For example, thyroid, anemia, vitamin D levels. Is someone just frankly depressed? Have they had age-appropriate cancer screening? We think about medications. One of the biggest offenders for causing some of these signs and symptoms are medications. Common class being beta blockers. New recommendations in blood pressure management every American should be aware of is that beta blockers no longer should be first line for just the treatment solely of blood pressure or high blood pressure, but they can have side effects: low energy, depressed mood, performance issues for men, major performance issues for men. So medication review, and then of course lifestyle management.
What if somebody wants to try to improve their drive, let's say, libido, you would probably call it? Are there other things they can do than take these medications?
Absolutely. Starting number 1, stress management. Number 2, sleep. Number 3, exercise. Number 4 would be medication removal. Saying, going to your doctor and saying, do I need to be on all of these medications? Side effects of many of the medicines that are prescribed can have some of these signs and symptoms that men are concerned about.
So there you go. You know, when you're seeing those commercials, remember what Dr. Ben Baechler is telling us here. Thanks so much for your time from the University of Minnesota.
You bet.
All right. Good to see you as always.
Likewise.